Good evening, students and faculty. My name is Melissa Maiden. I am currently a student in the BSN program at Northwest Florida State College. And today I'm going to talk to you about systemic lupus erythematosus. It is an autoimmune disease that affects mostly African American women of childbearing age from the ages of 20 to 40. Caucasian women are on the bottom end of that totem pole, which is shocking with the research that I found. SLE, or systemic lupus erythematosus, the autoimmune disorders where the body is basically attacking itself. Whenever there is an infectious process in your body, your immune system kicks in, you release antigens to go and identify that certain particular molecule or bacteria or fungus in your body, and you make antibodies. So you start to make antibodies, you have an inflammatory response in your body. Lupus is a chronic or reoccurring condition for these patients. There are 7.6 new cases per 100,000 people each year, so this is not one of the most common disorders, but you will come across it in the medical field quite frequently. If you look down here, May is Lupus Awareness Month. It actually has its own ribbon, purple. Down here, once the immune system has been triggered by the inflammatory response, the antigens are released, inflammation process starts, and then you come down here into this part where we show the signs and symptoms. Most patients will have a butterfly rash, like what they call a malor rash over their face. They may have areas of their skin that they have exposed to sunlight where they break out into a rash. They do have a photosensitivity. These patients they do not tolerate sunlight or bright lights very well at all. They can have some weight loss, extreme fatigue, they can run fevers. They are miserable, basically. Some of them have headaches, they have painful or swollen joints. There's a lot of inflammation that goes on in the body. Lupus is really hard to diagnose for these patients. Over here on this side, you'll look, it says 4 out of the 11 criteria must be met that I think it's the American College of Rheumatology has set up. There's 11 different areas that they set up where the patient has to fit into to be diagnosed with lupus. You have to match at least 4 of those. Lupus mimics a lot of different disorders and medical diagnoses in the medical field. So it's really hard to diagnose a patient. Some of the diagnostic tests that help diagnose this, doctors may order basic metabolic panels, complete metabolic panels. They're going to order some chest x-rays, some MRIs, some urinalysis. We're going to basically check every part of the system and rule out every other disorder. And then usually we fall into the net of looking to see if they are diagnosed with lupus. They always hurt. They have lots of pain. They have lots of rashes. They have lots of inflammation in their body. We treat these patients over here. There are some cytotoxic drugs that they would have to have infusions and go to infusion centers and be treated with. We are treating them with corticosteroids to decrease the inflammation in their body. Some of them take NSAIDs for the pain to help with the swollen joints and everything as far as that goes. Lupus is coming around with more and more diagnoses each year, and it's something that we need to be familiar with in the medical field so we can catch these patients that are falling through the cracks, that are coming in with lots of pain and inflammation processes that we don't understand. Some people get scrutinized when they come in for these things, so we need to be aware and be sensitive to the problems that they are having. Over here, I've got some information on the physiology of systemic lupus. These patients, are going through an inflammation process in their body. Their body's showing signs of infection. There's never a clear-cut answer for them. They can be very frustrated. There's currently not a cure for lupus, so these patients deal with this on a chronic basis. Some patients learn their triggers, so to speak, such as stress, medications, could be food related. There's all different kinds of triggers that can trigger the lupus for the patient. They learn these and they try to minimize their risk with it. If they are out in the sun a lot, these patients will start to be inside more. They'll wear sunblock. If it is stress related, they may take medication to help release their stress, or they may have to do changes in career, changes with family events. It's definitely coming around more often. So if you have any questions about lupus, feel free to ask me. Chose lupus because I'm trying to learn a lot of information on it myself, because I see patients that come in diagnosed with it and I just don't feel like I knew enough about it. I'm very surprised to learn some of the things that I've learned and learn some of the signs and symptoms, because they do mimic several different diagnoses, and I'm looking back now at patients I've had in the past and may see a possible diagnosis there for them in the future. With all the new treatments that we're having for these patients, hopefully one day we'll have a cure so we can help these patients on more of a permanent basis. Living with it can be difficult for the patient, so as a nurse, it's our duty to be sympathetic to that. So I appreciate your time today, and I hope you learned something. I know I did with this presentation, and I hope you have a great day.